So I hope I can add a little bit. So my work is in what's called clinical exercise. So I'm a doctor, but I've sort of spent my time moving from dealing with sports injuries originally to becoming more and more interested in just the role of exercise in helping people with chronic illness to have a healthy lifestyle or an enjoyable lifestyle. And just so when we say chronic illness, what we mean is what are called non-communicable illnesses like heart disease, lung disease, diabetes, MS, stroke, dementia, kidney disease, liver disease, arthritis, chronic pain, all of that. All of those things. Now, just on a show of hands, can I just ask, apart from your clots, how many people here have any other illness? Yeah. So it's very common, because these chronic illnesses that I've mentioned, they affect 40% of the entire population, including children. And in people of more mature years, the percent is not 40%, it's 85%. Over the age of 65, almost everybody has at least one of these illnesses. And many, many people have more than one. So just to begin with, I am going to say a little bit about clots, but I don't know anything remotely like what Fionnuala or Mike know, so don't be asking me any difficult questions. We'll redirect them straight away. But in a general way, this is important, right? People with chronic illness, no matter what the illness, they become less active than they should be. So that's what that highlighted box shows. Reduced physical activity. Now that leads on to reduced fitness. And these are the different components of your fitness: strength, aerobic fitness, flexibility, balance. They all disimprove if you're not active. And as they disimprove, what happens is the person becomes less mobile. And that leads to a loss of independence. And in chronic illness patients, there's a lot of distress in the family or in the people looking after that person. And that burden of care is very much underappreciated. And it's financial, it's time, it's emotion, but it's huge. And that all leads on to the person experiencing social isolation, loneliness, loss of motivation, fear of exercise. And then you get loss of confidence, loss of motivation, and the cycle goes on. And that happens in many, many people with a chronic illness, no matter what the illness is. And the point about exercise is that it interrupts that cycle. By getting people more active, we can have an enormous impact on how well they are. Because a lot of the unwellness that is present in any long-term illness is substantially caused by inactivity. By getting people more active, we can reverse that. And the critical point to appreciate is that we can achieve that without having to fix the illness. And the reason that's important is that the majority of these illnesses can't be fixed. They're not fixed. We live with them. But having an illness does not mean you have to be profoundly, regularly unwell with it. Okay, so that's the basic message. Now, to dive into DVTs straight away, this recent paper shows that exercise after a DVT is safe, it improves quality of life, it reduces pain, and it reduces the post-thrombotic syndrome severity. So the first question is exercise safe after DVT? And the answer is it is. And that work also showed that with early mobilization, within weeks of the clot, if you become active early, you've improved quality of life, you've reduced pain, and you have a significant reduction in the risk of having post-thrombotic syndrome at 2 years after the event. And with prolonged supervised exercise, there's an improvement in quality of life and the positive effect on symptoms of venous insufficiency and muscle function. So in a general way, one of the questions that I'm sure is commonly asked is, am I safe to exercise? And the answer is yes. Will it help me? The answer is yes. And what does it achieve? With regard to the lower limb, and Mike just touched on it there, that improving the strength of the calf muscles will improve its ability to do one of the jobs that the calf muscles do, which is this muscle pump activity, which is to drive blood back out of that leg towards the heart. Okay? And with immobility, you can develop weakness of any muscle that's not being used. And one of the principles of exercise in this context would be to just regain or enhance the strength of the calf muscles to help them to do what they normally do. Okay, that would improve venous return. Now, and there seems to be no increased or reduced recurrence risk related to doing exercise, but there is a reduced risk of mortality. So the recurrence of a clot, whether you exercise or not, may not be changed, but there is a reduced risk of mortality. And this association is most pronounced in patients with DVTs rather than pulmonary emboli. Okay? Now I'm going to, and this shows it. Okay? So on the dotted line is the survival rate over time of people who are inactive following a VTE episode. And the solid line is the survival probability of those people who are active. So from a survival point of view, there's evidence that exercise is a good idea. And this study, 2015, looked at the improvement in fitness in people who exercised. That's fitness up on the x-axis, or sorry, the y-axis. And this general improvement in fitness that occurs from pre-intervention to post-intervention in people who exercised. And what that means is that people exercising had a much higher level of minutes of activity than people who were not exercising. So the evidence that I'm going to just touch on in relation to clots is that it's safe and it helps. And the quicker the better, it seems. Okay? Now, the barriers, and some of them have been touched on here already in some fantastic contributions, are confidence. And this is now in general in chronic illness, but it'll apply here. But confidence is huge. Fear, which is related to confidence obviously, is also huge. And in people that we deal with every day in our program who are afraid of exercising, well, why? What are they afraid of? And depending on their condition, it may be that they're afraid of worsening their pain. If they have a condition that's associated with pain, sometimes it's embarrassment because they're overweight or they're not used to exercising or they're self-conscious. In some people there's a fear of falling if you exercise, depending on their condition. And what was touched on earlier as well is this fear of breathlessness. And being afraid of getting breathless is very, very common in chronic illness in general. But it's quite heightened, I think, here in people who have had a pulmonary embolus in particular, where breathlessness is a prominent symptom of the condition, and therefore experiencing breathlessness again can bring with it, God, is it happening again, or what's going on here? You know, so the fear of breathlessness is a big issue. Now, so how do we overcome these? Well, the first thing to do is to sort of put them out there and address them and acknowledge them and just talk about them. But the main thing that improves confidence, in my opinion, is just doing it. And probably initially doing it in an environment where you feel safe. Now that may be supervision or just being in a group or whatever it is, but that you're not sort of on your own. I think that the confidence is greatly improved by that, by the group environment, and also not only by the supervision element of that, but also by the social networking that goes through mixing with other people who have medical problems like yours and also medical problems not like yours. And that point is very important too, because people repeatedly tell us, so what am I complaining about? Look at that, looking at this person struggling with a particular challenge and doing great. I better get on with it and stop giving out. And then they do, and then they suddenly, God, I'm not dropping down with fear. I'm fine. And then suddenly they're launched themselves. Now, so all of that, and pain was touched on as well earlier. In our program, where we have, it's now quite a big program, there's 43 centres in the country, there's 6,000 visits every week across the network. Now we have a big team of 60 people. So we come across all of this, and the social bit is so important that it's more important, it's almost as important as the exercise itself. So basically, just to go through it very quickly, if you're somebody who's getting over an embolus and you're wondering about exercise, the basic questions are, well, how much should I do? What should I do? And how hard should I do it? Those are the three basic questions. Now, the how much bit we can deal with quickly, because what you're doing at the moment is nothing. This is called sedentary behaviour, sitting down, doing nothing. And there's now an entire science called anti-sedentary behaviour, which simply means interrupting this, not sitting continuously. And the example we always give in our inductions is to talk about the Late Late Show. And if you just simply stand up at the ad break, walk out to the kitchen, get a glass of water, walk back in again, sit down, do that 5 times during the show, simply doing that is enormously beneficial to your health compared with not doing it. That's the first thing. The second thing is, every single chance you get to do something, you should do it. Literally, if the doorbell rings, it should be you answering and not somebody else. If the visitors are in, you should fill the kettle, not somebody else. Literally that. But the experts want you doing 5 30-minute sessions of moderately vigorous aerobic exercise every week. That's what the recommendation is. And that doesn't mention the other important things, which are strength, and I'll come to that now. So that's the how much. And you should really, in my opinion, be aiming to do something every day. Something. Okay? The what type of exercise is really important. There's 3 types of exercise that matter. The first is aerobic exercise. That's the breathlessness. That it gets you breathless. That's what it does. It's large muscle group. Like, aerobic exercise is not moving your hands, it's moving the limbs. It's this. It's this, that sort of stuff. It's jogging. That's aerobic exercise. It goes on for a few minutes. It's really important because it's the one that puts your heart and lungs under a little bit of pressure in a positive way. So that, and you'll know they're under pressure because you're a little bit breathless. But it's a good breathless, because it's actually putting a bit of pressure on your heart and lungs, training them and making them stronger, not weaker. Now that's the first type. The second type of exercise that's very important is strength work. And strength work is often forgotten in sort of general clinical exercise. It's particularly important for women who have less muscle mass than men in the first place, because your strength peaks in your 20s and then it slowly fades into your old age, and we want to reduce the rate at which it falls, because the faster it falls, the more pressure comes on your bones and joints. And then the third type of exercise that's critically important is balance. So if you're in our program, you'll find yourself being asked to do funny things like all about improving what's called your core strength. And if you improve your core strength, you're less likely to fall. And for our group, that's critical. Okay? Now, how hard is the third question? And it's very simple. You don't need gadgets for heart rates, you don't need formulas, you don't need scales. You simply need to go by the principle of, am I a little breathless? And if I'm not, I need to go harder. It's that simple. And we use a thing called the talk test as a sort of a safety thing, so that if these 2 people here in front of me were exercising, you should both be a little breathless, but you should be able to talk to each other. And if this lady could sing this man a song while she's exercising, the way we interpret that is she's not exercising hard enough, because she should not be able to sing a song. But if she couldn't talk to him because she's gasping, she's going too hard. It's that simple. It's that simple. You just need a little bit of breathlessness. We make fun of it. Show me the red face. Show me the sweat. Where is it? Why isn't it there? Let's go a bit harder. Now, I could go home at this stage. That's my job done. But let's go on a little bit. Now, in the broader context, not just of clots, okay, because a number of you have other conditions as well. Let's just go ahead here. So, what is successful aging? Healthy aging. So back in the 70s, that was the definition, and it really focused on a lack of illness, an absence of illness. Lack of chronic illness, physical disabilities and risk factors for disease, as well as having some good mental health. But nowadays, the definition has been rewritten by the WHO, and it's all about healthy aging is the process of developing and maintaining the functional ability that will enable older people to do the things that matter to them. Now, I'm not for a minute suggesting you're all old people. Don't get me wrong. But at some point you will be. So it's all about retaining your functional ability. And this graph here shows the profile of how our health changes over the years. And the black line is, let's call it, normal people. And our health sort of status peaks 20s, 30s, and then falls away. Now, if you're a masters athlete, your profile is different in the following way, in that you remain well for much longer. And then you have what's called a compressed period of morbidity, where you go downhill quickly, but it starts later. And the aim of clinical exercise is to move you from this one to that one. That's the aim of clinical exercise in general. And another sort of perspective on that is this, where this is your musculoskeletal strength, or health, better or worse, up that graph, okay? And this is your age. And above a certain level of musculoskeletal fitness, you will have disability. So the aim of our lifestyle is to stay above it. And you tend to be well above it in your 20s, and you drift down towards it as you get older. And the more active you are, you'll be up here rather than down there, okay? And this graph just summarizes the influence of your level of physical fitness on your risk of dying. Okay? So this is the number of deaths in a 10-year follow-up based on your starting level of fitness. And this is the fittest group, the highest level of fitness. And this is progressively lower levels of aerobic fitness. And over a 10-year follow-up, the people at the highest level were given a ratio of 1. And see how much higher the other ratios are.
Can you reverse it in that, like, can you start at 60 and
you can
improve?
You can. Oh no, there's loads of evidence that you can move yourself from a bad trajectory to a good one. Loads of it. And it's never too late. And in actual fact, one of the things that's most dramatic about clinical exercise is the enormous improvements that you can see in very elderly people who start quite low, and quite quickly those benefits happen. And the other thing is, have I got it here? The other thing is that with relatively small increases in relatively hard exercise, literally 10 minutes a day, you can have a huge impact on your mortality risk and your quality of life, which is almost just as important. Now, just very quickly, just to dip into some other conditions, this is cancer. And this is a very famous study which looked at the influence of changing your exercise behavior on your risk of dying during the treatment of cancer. This is colorectal cancer. It's a famous study called the Nurses study from the States. And those people, during the treatment of their cancer, who did not change their exercise behavior, were given a mortality, some of them died obviously, and their mortality rate was given a ratio of 1. And what this basically shows is that if you reduced your exercise dose in that period, your risk went up, and if you increased it, your risk went down. And that is death from the cancer. And this is death from all causes in the same cohort and the same pattern. If you increase your exercise, you're less likely to die. Okay? Now, I want to show this next one, but I want to quickly move on to summarize it, because that's an awful graph. But what this study looked at was the effect of exercise on your likelihood of having pulmonary complications after surgery. And these are all different studies, and each one of them generated a data point. And basically what you need to know is if the data point moved to that side of this line, the risk of pulmonary complications was reduced. Okay? But to summarize it, because this is the type of surgery, this is different types of training, and this is different durations of training. And different papers, look, 23 papers, 5, 10, 6, loads and loads of different papers investigating these different things. And in summary, which I think is amazing, no matter what the surgery, no matter what it is, no matter what the exercise, whether it's aerobic exercise, interval training, no matter what it is, and no matter how long you did it for, even a week before your surgery, you have reduced risk of pulmonary complications. And these are the pulmonary complications which kill people: pneumonia and clots. So Anybody preparing for any operation, no matter when it is, in relation to now, benefits from doing any form of exercise. And the different types of exercise might be strength training, it might be inspiratory muscle training, it might be interval training, it might be aerobic training, it doesn't matter. Now, then Exwell, so we are a social enterprise, a non-profit. I worked in DCU for 10 years before I left DCU in 2019 to sort of pursue the rollout of a previously existing program called MEDEX, which was the very same thing as Exwell, but it's the previous generation of it. But the thing that, the innovation I suppose, is that you might be aware that there's a thing called cardiac rehab, where people who have heart disease go for an exercise program called cardiac rehab. There's a thing called pulmonary rehab, where people with pulmonary disease go for a program called pulmonary rehab, and so on. And initially we were doing the same in the community, but it became clear to us that everybody gets the same thing, and everybody needs the same thing, namely a mixture of strength work, balance, and cardiovascular exercise, the things I mentioned earlier. It doesn't matter what's wrong with you, you need them. And offering these different programs for different illnesses is unsustainable by and large, and there's no need for it because everybody gets the same thing. And the other thing is, by putting people together in one program, two things are achieved. One, it becomes more scalable, and number two, people get to see other illnesses doing fine, and the mixture is very good for everybody, very good. And as a consequence, we are now, we offer face-to-face classes. We're getting some good funding from the HSE. There's different ways to be referred, but we're now in 43 centres, we have 6,000 visits, blah, blah, blah. And we started off, that's about a 15-fold increase in activity since we started 5 years ago. And there's an enormous need for what we do, number one. And number two, we focus a lot on impact measurement. So any centre we're in, we measured the impact by doing some simple testing, questionnaire and physical tests of strength, aerobic capacity, all that, which are low-tech things that can be done in groups. And there is never-ending, consistent evidence that it works. Okay? So the core principles are exercise, the social interaction, and impact measurement. What's very interesting for us is the whole thing about in group exercise is, why do people engage and why do they not engage? Why do they tell us they'll come and then not come? And when they do come, why do they stop coming? All that. It's an incredibly interesting area. We've become fascinated by it, and we're putting enormous effort into trying to improve our own performance in that. Really, really interesting stuff. The social interaction piece is highlighted by, we did a study when we were back in DCU on the impact of our program. It was HSE funded study, went on over a year, an enormous study. And there was loads and loads of benefits shown. But one of the things that was really interesting was that for a number of the benefits, it didn't matter how often people came. You'd imagine that the more often they came, the better they'd get, like the more benefits. And it was true for some of the outcomes, but not for all of them, including, for example, blood pressure. There was a big beneficial effect on blood pressure measured by 24-hour blood pressure monitoring, and it didn't matter a hoot how often you came. You got this benefit. Amazing, and it makes us think, well, what's going on here? And it makes me think of this, the networking, and all the benefits of that are really, really important. Okay, so that's where we're at. Now, I'm just going to summarize. Now, I'll show you what these mean, but these are our outcomes. So this is a thing called the 6-minute time trial, which is how far can you cover in 6 minutes, going out and back across a 20-metre track in a hall. So obviously, the further you go, the fitter you are. And an improvement means an increase in that distance. So this is a study done when we were in City West, just after 6 weeks, nearly 200 people. And there's the improvement that you get in the 6 minutes. And that is a significant improvement. This thing here is the sit-to-stand, is the time taken to do 5 sit-to-stands. A sit-to-stand being standing up and sitting down, okay? And that's a measure of strength. And an improvement in strength is a fall in that time. So there's the fall in that time. This one here is the timed up and go test, where you stand up, walk around the cone, come back, the cone is 3 meters away, come back and sit down again. Go as quick as you can. And that's a good risk, a predictor of your risk of falling. And an improvement in that is a fall in that time. There's the fall in that time. And the fourth one, this is self-rated health. In a scale from 0 to 100, how would you rate your overall health today? Give us a score, and we want to see an improvement, and there it is. So in all of these major things, there was a significant improvement. And the really interesting thing was, if you took any of them, so this is taking the 6 minute, so there's the overall score again, an improvement from here to here, right? If you then split those people and showed what was the change like in those people who started off very poor versus those who started off quite good. So these are called tertiles. They were ranked based on their baseline performance. And see up here, there was a little improvement here in those who were already good, but there was a much bigger relative improvement in those who started off here, who were the weakest. The relevance of that being that, and this was a consistent finding in all of the outcomes, that the greatest relative improvement occurs in those who start off the weakest. These are the very people who might struggle to have the confidence to try the program because they're the weakest. They do the best. And that's a very important thing for us to be able to say, so that our key messages are, sorry, I'll leave that, that no matter what's wrong with you, no matter how long you've had it, no matter how bad it is, if you give it a try, you will improve. Okay? Now, in terms of you guys, so the how much, the what type, and how hard, I'm just summarizing them here. Every little bit helps on the how much. Anti-sedentary. Aim for nearly an hour, 3 to 5 days a week of something. Try and do it, some of it, with other people. Okay? The aerobics, the strength, the balance, and how hard. Now, I'm going to just show you the most beneficial exercise any of you can do at home is this. We'll just do it together now. It is the sit to stand. It is recognized that this is the very best thing any of us can do. So a sit to stand is like this. So you would fold your arms and just stand up and sit down. Now, for people who are not able to do that, they would hold on to the radiator or the windowsill or the table, or put a second chair in front of them, hold on to it, and go up and down, okay? For those who are good at it, or as they progress, what you do is you go up and you put the hands up, and you also lift your heels off the ground, okay? Which is quite interesting in terms of the calf muscle strength issue for you guys. So let's try that now, and what we'll do is, and actually, what I'm going to do, wait for this, can I just grab my bag for a minute? Is it back? This is actually much better done to music. Where did I put my bag? And in our classes, which Boney M track are you going to use? I'm not going to use Boney M, but in our classes, when people hear Jackson Browne coming on, they groan. Here we are.
Staying alive, staying alive.
No. So let's just try this in a minute. Let me see. Well,
Get up, stand up for your rights. To be free.
okay, here we go.
Stand.
No. Okay, I will just demonstrate this. Now, watch. Up, down, up, down. Are you ready to try it? That is quite fast.
That is fast.
Okay, well, I'll take your advice and go to a slower one. Anybody know Chinatown? This is slower. This is more civilized. Listen. Up, down, up. Let's try it. And if you're able, When you come up, heels off the ground. Hang on my count. 3, 2, 1. Up, down, up, down. Heels off, down, up. 4, up, down. 5, up. 6, 7, down. 8, 9, down. Stop. Now.
Sing a song now.
Just to show you the difference. Just to show you the difference that a slight change in tempo makes, right? This is Jackson Brown. Let's try it again.
Oh wait, no, let's
We'll just do 5 at Jackson's pace. Ready? Hang on, I'll tell you when to start. 3, 2, 1, and up, down, up, heels off the ground, up, down, up, down, up, down. Stop.
show off. An extra one.
No. And then another adaptation that you take your 2 dumbbells in your hand, 2 kilograms, not heavy, and you're holding them as well. It's a fantastic exercise, and it's the one you can do at home. And if you're struggling, just do 3 of them, but do it several times a day, and that's how you ease into it. Okay?
Any kind of weight in your hands, like 2.5 kilo, 5 kilo, doesn't
Yeah.
matter.
2 tins of peas, anything. It doesn't matter. But you don't need weights at all.
No.
Like you can just do it, and
Just did 15 there.
but the adaptation is heels off the ground. Heels off the ground, because there you go, doing your calf exercise. Okay. All right. Now, that's me finished. If anybody's interested in Exwell, on our website you'll see where we are. We're in 11 counties at the moment. We're hoping to do another 6 this year. We're in 43 centres, mainly GA clubs, community halls, so you'll find us somewhere, and it just means the medical referrals. In some places we're funded by the HSE, in which case there's 3 months of free classes, free, after which if you want to stay you pay, and in some places we don't have funding, and if you don't have funding the charge is about €7 a class or 8, and in some places we have some subsidy from a local entrepreneur or business, and you'd be very interested to hear that when we were in Balbriggan, our local patron was the undertaker. Anyway, there you go. Thank you very much.